Hi, this is Shilpa here, and welcome to this blog series on miasmatic, questions. I've been answering questions by my students, by my Argentum mentoring students on, working and treating miasmatic cases and complex cases, especially when your favorite remedies and favorite approaches are not working well, right? So this is a question by Megan, and that's what she says. So sometimes I can see that a patient has a psychotic or a syphilitic state that needs treating, but say Medorrhinum, Thuja, or Cephalinum mercury doesn't seem appropriate, which means the patient doesn't fit their picture. I'm talking of cases where there isn't an obvious anti-miasmatic remedy that fits the bill. In other words, the miasmatic state is clear, but the remedy isn't. How do you treat these cases? This is a very good question, Megan, and it gives me also a good opportunity to explain the role, the multifaceted role of miasmatic remedies. So for me, just to keep it very simple, there are two major ways in which you can use so-called miasmatic remedies like Thuja or Medorrhinum or Murxol or Cephalinum in your patients. One, as an indicated remedy, and two, as a miasmatic remedy. Now, it's very important to know the differences between two and have a very clear intention when you're using them, so you can avoid any confusion in prescription and also your follow-up assessment and clearing that expectations from the patient. So first, let's go to scenario one, when you're using these so-called miasmatic remedies as indicated remedies. So now this can only be possible when you have a well-developed individual picture, which means you have a well-developed personality trait, constitutional traits, fundamental miasmatic triggers, where you are looking at, say, so-called stage 4 information. Or you should have good concomitants, peculiar mentals, generals, you should have good exciting causes. All these are stage 3 symptoms. Or you could have local keynotes and concomitants which are local at stage 2 and so on. This is how you can confirm and hence prescribe that miasmatic remedy as an indicated remedy confidently. You have the evolution of the picture from stage 4 to stage 2 and 1, whatever your patient presents at. Now, let's go to scenario 2. When you're using these miasmatic so-called remedies as pure miasmatic remedies on miasmatic indications. Now, miasmatic indications are different than your so-called homeopathic, what you know as, so-called homeopathic indications. Miasmatic indications and the remedies prescribed on these are generally needed in cases at stage 1. Why? Because this is where what you say comes true. These are the cases where the miasmatic state is clear, but the remedy isn't, because the indications, there are no good homeopathic peculiars in this case. There are only vague disease symptoms, local symptoms. These are so-called highly suppressed one-sided diseases. Remember, the major aspect of homeopathic prescriptions, good homeopathic prescriptions, is to have some form of peculiars, some individuality, which these so-called stage 1 diagnostic, basic cases do not have. So now your question is, how do you treat these cases? As I've mentioned, we have to use anti-miasmatic remedies based on miasmatic indications. How do you do that? So let me give you two common ways. One is where you look into the past history or the prenatal history or the family history and find some miasmatic trigger or fundamental trigger that the chief complaint, the present problem, traces back to. You could have some form of intense acute viral or bacterial disease. You could have some form of, venereal disease, STDs, some form of toxicity due to a suppressive conventional treatment, some form of, some repeated vaccinations, substance abuse, addiction, some strong chemical exposure, heavy metal poisoning, whatever. These are all miasmatic triggers and you need to know them. So those are when the patient has a clear, not been well since state since that problem. This is what we call a miasmatic indication or a trigger. In this case, I will start with a miasmatic nosode that corresponds to that related trigger, or a miasmatic remedy that matches that trigger. So to give an example, in your case, you will be using Medorrhinum in suppressed gonorrhea as a past history, or Cephalalinum in a past or a family history of syphilis, and so on. This in itself can open up the case in the right direction, boost the vitality of the patient. So the systems now start throwing some suppressed deeper symptoms, express them to the forefront in the form of some peculiars. This will help you make a much more clearer secondary prescription with a good indicated remedy. So in this case, you start with a nosode or some specialized miasmatic remedy, which is based on that trigger from the past, and you are basically using it at stage 4 without knowing the full expression of the disease. All you have is this sort of trigger, and then the pathology at stage 1. You do not have any confirmations at stage 3 and 2, which is very important for us to know the full picture, right? Now, this is something I highly recommend rather than throwing in any specifics or a pathological or an organ remedy that could result in suppression. A miasmatic remedy will always work from within outwards, because it's triggering the system right at the start, the source at stage 4. This is why we call this process in Argentum the startup strategy. And you've seen, we have this huge big course on the startup strategies, and all that is, the whole process is all about, using the anti-miasmatic remedies perfectly and confidently, and then using an organ remedy along with that. So this two-pronged system makes it very highly effective. 90% of your suppressed one-sided cases will start healing in the absence of good homeopathic indications. That's the trick. So this is one way of how you can do it. Now, there is another way, because there are cases where you do not find obvious fundamental causes, such triggers. I mean, this is ideal, but our patients are not ideal. So you find nothing in the past history, nothing in the family history, nothing in the prenatal history. So in this case, you find some predispositions or some tendencies which relate to certain miasms. And these tendencies you will find in the past or family history. So let's take your example of Thuja or Medorrhinum. They're both great polycrates. They can be used as constitutional remedies. But when you're using them as antipsychotic miasmatic remedies, and there is no history of gonorrhea, all you have is to check the past history and look for specific psychotic patterns and predispositions. So, for example, one of the psychotic predisposition is a history of some sort of pelvic inflammatory disease, or some pelvic, uterine, ovarian, or abdominal complaint, or a tendency to growths, or hypertrophies, or cysts and warts, or tendency to have copious, thick, profuse discharges from the eyes, from the nose, or susceptibility to joint complaints, rheumatic issues in damp weather, sore hard muscles. That is what you look for. This is psychosis. You do not need peculiars here. So if you have 1 or 2 or 3 of these, that's great. Then you can use Medorrhinum or Thuja to clear this psychotic source block along with your organ remedy at stage 1. Now, having said that, there are a few clinical criteria I use to now differentiate in between these miasmatic remedies. So I know, for example, like Thuja. So now I'm making a choice, right? Thuja or Medorrhinum. Thuja will work better if I know my patient is chilly. Medorrhinum is much more indicated in warm-blooded patient. Or if I see a history of vaccine damage, I would go more towards Thuja than Medorrhinum. So these are clinical pointers that I keep on, talking about and showing you when you present your cases in Argentum. So this will help you become more and more better at using these remedies on miasmatic indications clinically. But remember, you make the best possible choice. You get that foot in the door. You open the case. The patient comes back with much better indications for a good second prescription. They will start showing symptoms at stage 2 and 3. This is what we need. And if you like more on this, then check that, on how I use these anti-miasmatic remedies based on miasmatic indications across all miasms with some case examples. Check my book on Guide to Miasmatic Maze. I have elaborated this process very, very clearly in that. I'll provide you the link below. So to summarize, scenario 2 is about using miasmatic remedies on miasmatic indications. They are intercurrents, right? The intention is just to open your case, develop the picture, desuppress, for want of a better word, throw a much more fuller, clearer picture, and so you know what to base your secondary prescription on more confidently. So the same remedy is being used based on how your patient is presenting, not based on what you believe is the right approach. We always match the approach to the patient and not to a favorite, approach that we know, right? So hope that helps. And yeah, I'll see you in the next video with, another interesting question. Thank you so much.